Hi, my name is Tiny. I'm going to be your nurse practitioner. Can you tell me your name and date of birth?
My name is Kevin Cruz, 9/2078, my date of birth.
Nice to meet you, Kevin.
Nice to meet you, Tim.
I'm here to take an assessment of your head, eyes, ears, nose, throat, lung, and heart function. Is that okay with you?
Yes.
Just looking at you, I'm looking at your head. It's normal cephalic, which means it's a normal shape. Looking at your skin, it is normal. And your eyes, they are equal bilaterally on both sides, and they're symmetric with your head. Your nose is midline. It is also symmetric with your face, and lips show no signs of cyanosis, which just means bluing color of your lips.
Okay.
Okay. If you don't mind, just going to go ahead and feel your head,
Okay.
and I'm checking for any nodules, any lesions, which I do not feel any, which is good. Um, and now I am just looking at your eyes and just going to take a quick look at your eyes. Um, we're checking for perla. So look at me. Beautiful. Great dilation. Follow the pen. I'm going to do it one more time. Okay, that's great. So we do have perla. Um, Checking for extraocular movements. So I'm going to have you follow my finger. Great. I am going to check for corneal light reflex. Just means the light reflecting off your eyes. And I do see it. And I do see it. Okay. So now I'm just going to take a look inside and look at your optical nerve. And the other one. Okay. I'm going to give you this eye chart and just ask you to read it for me. With both eyes open, read the lowest line you can read with no problems from that distance.
PEZOLCFTD.
And that is line 11.
Line 11, yes.
Okay, so I'm going to ask you to cover one eye and read the lowest line you can read with no problem.
I'm going to go with FD. I think that's a PDFLTZEO. That's 10, but I think I can read 9 better. LEFODFCT.
So that is line 9, and I just need to confirm. Line 9 is 2015 with -1. Okay, I'm going to ask you to cover your other eye and read the lowest line you can read.
PEZOLCFTD, line 11.
Oh, that's great. That was 2010 vision with no errors. So that's pretty good. Okay. So I'm just looking at your eyes, looking at your sclera. Your sclera is white. That's the white of your eye. I'm going to pull down on your eyelids, your bottom eyelids, and it's pink and moist. Now close your eyes, and I do feel the resistance. So that is good. Now we're going to move on to your ears. Your ears are, I can see from here, they're symmetric. They're equal in shape and size. I'm going to go ahead and feel your ears, your pinna. Any pain?
No.
Okay. your auricles, no pain,
No.
and your tragus, any pains?
No.
Okay. I'm going to take a look inside your ear, in your ear canal, and take a look at your tympanic membrane, your eardrum.
Okay.
Okay. Okay. It is gray and pearly. No signs of infection. Gray and pearly, no signs of infection. I'm going to look into your nose while I have this light on. Okay. Your mucosa is pink and moist, as it should be. Now I'm going to do a whisper test.
Okay.
All right. I'm going to cover the side of your ear and whisper a word to you. Funny. Can you repeat that word?
Fun. Hat.
Perfect. Now we're going to do what's called the Weber test. I'm going to strike this tuning fork and place it on the top of your head. You just tell me where you hear the noise.
Both ears.
Great. I'm going to do now the Rennie test. And that was the normal expectation. Now I'm going to do the Rennie test. And what this is, I'm going to strike this. I'm going to place this, the base of this tuning fork at your mastoid process behind your ear. I would like for you to tell me when you no longer hear the noise.
I don't hear it.
Do you hear it?
Yes.
Great. That's a positive result. I mean, that is an expected result. Um, and what that means, we're going to do the same thing on the other ear. What that means is that your air conduction is greater than your bone conduction. This is what we expect to see.
Okay. I don't hear it no more. Yeah, I hear it.
Great.
Okay.
So now we're going to move on to your nose. I'm going to feel your nose. You tell me if there's any pain.
No.
Okay. Nose is soft. Um, I'm going to feel your temporal sinuses.
Mm-hmm.
No pain.
No pain.
No fullness. No fullness. Any pain?
No.
Great. I'm going to percuss your sinuses. Okay. I'm going to ask you to clench your teeth. Great. So your masseter and your temporal muscles are intact. Um, I'm going to ask you to close your eyes. I'm going to place something in front of your nose and ask you to smell it. Tell me what it is.
Like a lime.
Great. And then I'm going to have you keep your eyes closed and stick out your tongue. I'm going to place something on your tongue. You tell me what it tastes like.
I don't know. Salt.
Yes, it should be salty. That's correct. So those cranial nerves are intact. Keep your eyes closed for me. I'm going to feel the side of your face. You tell me where I'm feeling.
My left cheek.
Okay?
My right cheek.
Okay. You can open your eyes. So your facial nerve is intact. Cranial nerve 7. And so now I'm going to ask you to open your mouth for me. I want to look and take an examination of the inside of your mouth, an assessment of the inside of your mouth. That's great. Oh, that's great. That's really good. I see everything. It's very pink, and it's not very pink. It's normally pink and moist back there. Uvula is midline. Um, yep, that's great. You lifted your tongue for me. That's great. Um, your soft and hard palates are intact with no lesions, no ulcers. Adequate dental hygiene. Do me a favor. I'm going to place my hand on the side of your cheek with your mouth open. I want you to push your tongue against it. Oh, great. That's testing your the strength of your tongue. That's great. Now I am going to test your gag reflex. So I'm going to stick this in your mouth. Okay. All right. Open your mouth for me and stick your tongue out.
That was enough. That was
Okay. Okay. But the gag reflex is obviously intact. So that was great. So I'm going to move down to your throat. So while I'm here, I'm going to palpate your carotid artery. Oh, that's good. That's good. One at a time we do it. So now I'm going to go ahead and palpate your thyroid gland. Okay. Okay. Do me a favor and swallow for me. Oh, that's great. That was the expected reaction. I'm going to ask you to, then I'm going to just push your thyroid over so I can palpate for nodules. And I'm going to push it to the other side. Okay, that's good. All right, now I'm going to feel for some of your lymph nodes. So I'm going to start back here, posterior auricle and anterior auricle. And submandibular and submental and posterior cervical and anterior cervical. That's great. And then superior clavicular and inferior clavicular. All good. I am going to go ahead and take a listen to the back of your, well, I'm going to palpate your back. We're going to check for lung sounds. And we're listening for resonance, which is what I heard. And I'm going to listen for your lung sounds. So take a deep breath. And as you're breathing, I'm listening and I'm watching. Your breathing is even and symmetrical and regular. Great. Great. Okay, you can breathe normal. I'm going to place my hands on your back and ask you to say a word. Can you say envelope for me? Envelope. Great. So I do hear the tactile, I feel the tactile primitive. I'm also going to ask you to say that word again. Envelope. So I hear it from the front as well. I'm going to percuss again. Once again, listening for resonance. Okay. And I'm going to take a listen to your lung sounds. I ask you to take a deep breath in and out. Oh, I'm sorry. In and out. Keep going. One more. Great. Okay. While I'm here, I'm also going to listen to your heart sounds. We're going to do your aortic, which is the right second intercostal space, your pulmonic, which is the left second ICS. Then we're going to go down to Erb's Point, which is the third ICS. Further down is the tricuspid, which is the fourth ICS. And then the mitral, which is the midclavicular fifth ICS. Pulmonic, that was aortic. This is Erb's Point. Tricuspid, and this is the mitral. I'm going to have you take a deep breath in for me again, and out. In and out, and push again. Push your arm, your shoulders up for me. Okay, great. Um, and I'm just going to feel for your PMI, and you can breathe regular. And I do feel that. I also see that your chest is symmetric. I've seen that. Um, and no dissension, lesions popping out. Everything looks normal. Okay. Um, I'm now going to listen to, I'm actually going to ask you to lay down at this point in time.
Okay.
Lay with your head right there. Okay. So I'm going to feel for um, a bruit. Uh, I'm actually going to ask you to turn your head to your left. Okay, so I see that there is no jugular vein distension. Um, and then while I'm here, I'm just going to make sure I do not feel really a thrill in your carotid and now your aortic and now your renal, iliac, and femoral arteries. No thrill found. I'm going to ask you to look the other way, turn your head the other way, and just check for this carotid. Okay. Now I'm going to listen for bruit in those arteries. I'm going to listen in your temporal artery first, which I do not hear one. I'm going to listen to this side. Thank you. Okay, and then this side. Okay. Okay. Now I'm listening to your aorta. No bruit felt in any of those. No bruit heard in your aorta. Renal. Iliac. And femoral artery. No bruit felt, heard in any of those, which is good. These are all normal findings. All right, and now I'm going to palpate for your temporal order. Okay, and your brachial. And I'm feeling also your radial at the same time. Great. Now I'm going to feel for your ulnar. Okay. Great. And your femoral arteries. Thank you. Okay. And your popliteal artery. Your posterior tibial. And your dorsalis pedis. While I'm down here, I am going to take one sock off because I'm going to do something called a capillary refill, Just checking how fast the blood flows back to your toes, and it is less than 3 seconds. I'm gonna come up and do it to your nail, one of your fingernails, and then we're all finished.
Put my sock back on.
No problem. And that is less than 3 seconds. And we are all done. We're completed at this time. Thank you for your time.
All right, that's it, done.